All right, very good. So go ahead and get started. I'm back. Sorry. AI companion wanted to make sure I was still okay with you recording. So
Just
Julia Juice, yeah, I
I'm
said
trying it
yes.
out.
Yeah. So happy to have all of us together this morning. Happy to have the opportunity to disseminate some of our curriculum information about youth to adult healthcare transition um, for you guys at UW-Milwaukee. So thank you for that. Our plan is to basically deliver the content of the four modules that we've created to you. Those four modules you can see in front of you, and then we'll go through each one of them. My goal today for our first hour is to go through module one and module two, um, the basic overview and then implementing. There is a little bit of duplication in these as they were intended to be delivered serially, but there is definitely times where I have combined these two modules. And so we'll look at that together and kind of talk about some adaptations that might be helpful depending on your timing. And then during our second meeting, we'll plan to go through module three, which is our provider supported decision making, supported decision making and guardianship module. It primarily focuses on supported decision making, but does have some information about guardianship just because of the contrast and the comparisons to those different uh, avenues for self advocacy. And then the fourth module is a healthcare provider's guide to working with patients with intellectual and developmental disabilities and some considerations and adaptations for practice with patients. So if that sounds all right, we'll dive into module one. So my plan, if it's okay with all, is to keep us set up with basically this slideshow version, mainly because I think it's helpful when we're talking about giving you the material that you have the notes available, and we can talk about those notes that are available for some of the slides also. So I've always been a very informal presenter. Please interrupt me, ask me questions, clarification. If there's something on the slide notes that doesn't make sense to the slide, ask me questions because I want to make sure that the material we're giving you is helpful and makes sense for you to deliver at a later date. So basic overview of youth to adult health transition. This is an acknowledgement. We at the Wiseman Center, the Youth Health Transition Initiative is funded by the Maternal Child Health Title V Services Block Grant. And so this license enables us to disseminate this material to you, and it also enables you to adapt, build upon, remix, redistribute. So we'll talk about that as far as like slides. If there are slides in here where you're like, that's just not applicable for our curriculum use, I'm going to hide those slides, that's okay. If it's, hey, I'm going to put module one and two together into one PowerPoint for this class period today that I have time to deliver both, great. We just ask that it long-term you provide attribution to the Youth Health Transition Initiative as the creator of this content, if that makes sense. So there is just a little bit of information here about me. So if you're wondering and want to reference or ask questions later, I'm the person who either created all this content or helped guide some of our leadership and education and neurodevelopmental disability students and fellows in creating this content. So um, that's me. And then we always, whenever we do any of our work, we talk just a little bit about where the Youth Health Transition Initiative falls in our state network of programs for children and youth with special health care needs. And so those are our partners in the state. And Tim and Lynn can elaborate if I'm overlooking any significant points to make about those partners. Tim has a lot more knowledge about all of our partners that we work with. Our focus is the Youth Health Transition Initiative or Health Transition Wisconsin. And our goal is really that It is a statewide and national system that works with healthcare systems, clinics, parents, and families, and of course, our youth with special healthcare needs to make sure that uninterrupted healthcare services are available to them as they transition from pediatric to adult healthcare. I would be remiss if I don't mention a couple of resources and partners that are really, really essential to the work that we do and are probably one of the best set of resources that we want to make sure that youth and family and caregivers have available to them. And one of those is the Wisconsin Wayfinder as part of our Children's Resource Network. And it's really kind of one-stop shopping for families with children ages 0 to 21 to get information. So at the end of the day, if all else fails, if families have this number and this website in their arsenal, if they remember nothing else that we give them about information for health transition, this is a resource that can help them reconnect with some of that information. So we always talk about that, and we always talk about the work that is done with our children's resource centers, which is where our Wisconsin Wayfinder is home. And so we have 5 different resource centers in the state of Wisconsin. Down in the Milwaukee area, you're part of our Southeast Resource Center. And here in Madison and Dane County area, we're part of the Southern or South Resource Center. So direct contact there for that resource center for each region. All right. So delving in, these are the 4 objectives that we've identified from this module that we hope that learners will be able to walk away from after exploring and learning this content. And so defining that healthcare transition, describing the current state of healthcare transition efforts in our state and in the United States, talking about at least 3 barriers to healthcare transition, and identifying at least one strategy and one resource that could help support healthcare transition in a clinical practice. So again, definition of healthcare transition. This comes directly from foundational article that the majority of this work comes from, which is White and Cooley, the foundational article of supporting the healthcare transition from adolescence to adulthood in the medical home. That article has been reaffirmed at least once since this 2018 version. I still usually reference the 2018 version because the 2023 version really just changed some dates and not much for content. So I typically will reference the 2018 version, but that is foundational literature that supports almost all of our health transition work. They offer many guiding principles to the work. I highlight 9 of them, and they're really very simple. It's a process. Start early and keep going and keep working on it a little bit at a time. It's really important that we recognize cultural beliefs and socioeconomic status and the impacts that that can have for access to healthcare and transition services. Right along those lines, acknowledging individual differences, just like individuals without disability. Individuals with disability have unique individual differences that we have to take into consideration whenever we're doing this transition work. It should be youth-centered and strength-based focus. A lot of our healthcare system spends a lot of time not focusing on strengths. Youth to adult health transition is one area where we definitely can focus on strength and should be looking at what are the opportunities for this individual to be involved in this process. Recognizing vulnerabilities and a need for population health approach. We continue to hear more and more about that in every avenue of healthcare. So just thinking about that, a population health approach. And a continued emphasis on health equity and elimination of health disparities. Again, widespread throughout all avenues of healthcare that we need to think about, but this is just an area where vulnerable populations with disability are just more, I think, prone to inequities and disparities. And the last 3, an emphasis on family and caregiver engagement. If you've ever done any work with families of individuals with disabilities, which clearly all of us here have, our caregivers and parents They know their children. They know their strengths. They know their areas of need. And so we have to work together to really help take the best care that we can through this transition process and acknowledge their knowledge. We have to allow the youth to build knowledge and decision making skills and that emphasis on self determination and self management. And so these three right here really represent a balance, right? Families, caregivers, parents know that youth, and we need to help lean on their knowledge. But we also need to figure out how to help this youth um, learn self management and become more independent or as independent as they are able based on their abilities. So, those are kind of those guiding principles that we talk about. Um, Measuring transition success. There is a lot of different ways that you can measure how are we doing? Are we doing this work? I focus on these three areas of measuring transition success because when it comes down to it at the end of the day, the Biennial National Survey of Children's Health, these are the three questions that they ask on their survey for families of that assesses if their child is receiving transition related care. So those are the three questions that we really focus on. Did the youth have time alone with the provider during their last visit? Did the provider work with the youth to gain any area of self-care skills or understand healthcare changes that might happen at around age 18? And did they talk to the youth about seeing providers who take care of adults or treat adults? So the question that comes up next is, well, how are we doing? In Wisconsin, what does the work look like for transition? And these numbers were recently updated. So this comes from the 2022-23 National Survey of Children's Health. And they estimate that 27.7% of children and youth with special health care needs are receiving transition-related services in Wisconsin. So based on those last three questions that we talked about 28% of families say are receiving those services. Nationally, number is a little bit lower, 21.8% or estimates 22%. There are some additional notes here that I did capture from that national survey of children's health that Lynn had compiled for us. And so sometimes with some curriculum programs, I would go into a little bit more depth about some of these elements and how they identify these kiddos with the screener. So that's something just to note on this slide that you may want to consider for how it fits with your group and the course that you're working with. So just a slide to emphasize that the opposite part of those numbers means at least 78% of children and youth with special health care needs in the US and at least 70% in Wisconsin are not receiving transition services. And these numbers are just for our youth with special health care needs. These numbers are worse or more dismal, if you will, for our neurotypical youth and youth that do not have disability in the state and the nation. So, what are the barriers? If you go back to that White and Cooley 2018 article, there are lots and lots of them. I have kind of synthesized them as they have into three categories. There are patient related barriers, there are what they identify as inadequate planning barriers, and a big category of system barriers. So, when we talk about the patient barriers, they primarily fall into this fear, new healthcare system, hospital provider, this fear about all of these new experiences, services, and environments. From families, we repeatedly hear, will our experiences be honored? Are you going to listen to me when I say, this is not right for my son, something is wrong? Right? That loss of control and leaving that pediatric setting, moving into a more adult setting, which always isn't as warm and fuzzy and accommodating as our pediatric settings. Just meeting new people and new providers and having to start over with the story of what happened 20 years ago, 10 years ago, 5 years ago that now builds to where we are today. Logistics. We might have went to one location which had multiple multidisciplinary clinics that we were part of in a pediatric setting, but now those are all individual separate clinics with separate providers in different locations in many of our health systems. Treatment plan changes. We've all been there when a new provider says, I don't think that's the best plan for you, or that might have been okay 5 years ago, but we don't do that anymore. And now we're looking at changing treatment plans that maybe have had benefit, maybe have worked well, or maybe are things that need to be changed, but it's still uncomfortable and fearful for families. And all of those things kind of wrap up into this negative beliefs about the adult system. And so they all kind of build together into that kind of negative connotation that we really have to work with families on helping to reframe if we can and help them find positive experiences. When we talk about inadequate planning barriers, um, they really focus kind of on these four areas. Number one, that not having seen a provider alone. If we have a youth that has never had the ability to practice that skill of communicating with a healthcare provider, and magically at 18, we pop them into a room with a new provider by themselves, it's not going to go well. So that kind of planning and working ahead to help everyone understand the process and practice that process so that they are able to do it when the time comes. There are socioeconomic impacts, some things that we cannot change, some things that are difficult to influence. Age, sex, race, ethnicity, mom and dad's socioeconomic status, which impacts living conditions, education levels, insurance, travel distances, just so many areas that we have to take into consideration. Um, Youth are less interested in health. If you have children, this will not be a shocker to you. I have a 14-year-old and a 16-year-old. My 14-year-old with Down syndrome could care less about 2 minutes alone in the room with his provider. He literally just goes and walks out the door behind me. My 16-year-old says, "Whatever, I'm fine. I don't need to go." So it's really hard to develop skills in our youth to go to the doctor and learn how to go to the nurse practitioner or the doctor and ask questions because they just really aren't very interested sometimes. And then just the bigger picture of inadequate support and preparation. If we do not actively encourage our youth to start asking some questions, spending time alone, learning about their own healthcare, they're not going to magically be ready because they turn 18 on a calendar. So those are some of the planning barriers that we talk about. And then I spend a little bit more time, as you might imagine, on systems barriers, because this is probably one of the biggest areas of barriers. And from the provider standpoint, especially when we talk about physicians, PAs, nurse practitioners in primary care, there are lots and lots of systems barriers that contribute to challenges in youth to adult healthcare transition. The first one I talk about is lack of communication or coordination between providers and systems. You know, it's one thing if I am at work at UW Health in my Epic Health link and I want to send a message to one of my UW Health colleagues, right? That's easier achieved. But now, if I want to send a message to Eugenia, maybe at Children's of Milwaukee, those systems really don't exist well. I'm literally back to old school. Let's print it and fax it if I've got a fax number or mail it. Or I'm going to give it to the family and ask them to remember to take it with them when they're trying to find a new location with a new provider at a new address in a building on a day when maybe somebody's not feeling great. So providers tell me time and again that communication from provider to provider is really difficult. Lack of time, lack of tools, lack of resources. Additionally, we talk about the limited availability of adult primary care and specialty care providers. I only get to speak from my experience as a primary care provider in UW Health, but I hear others echo that in other systems. I have a very specific template. My template for seeing patients is 30 minutes. It does not matter what, why, how many problems, how many issues, how long it takes us to communicate. Um, I get 30 minutes. Maybe I can structure things so I can say, hey, can you put Mikey into my 11:30 slot? Because then I know I have my lunch hour to assume it, or maybe the last slot of the day. I have some of those capabilities, but there is limited ability sometimes in many of our systems to accommodate some of our additional needs for individuals with disabilities. Um, Lack of matching systems. I spent 5 years at the Youth Health Transition Initiative trying to work with UW Health to say, hey, how are we going to match up this population with adult providers? Is there a way we can put something in with our welcome center? Is there, surveys, et cetera? And didn't make a lot of progress. There are not good systems in our healthcare systems when a family calls and says, okay, my son Bobby is now 17, needs an adult provider. His pediatrician is retiring. Can you help me find a new adult healthcare provider that can help us manage his complex needs, whether it's a G-tube, whether it's autism spectrum services, et cetera. There aren't systems to match. And families talk about just that barrier, right? Finding adult providers with specialized knowledge, uh, lack of transition training and residency. This is improving. I've been part of some initiatives to help facilitate that. I am hopeful that this initiative through our DNP programs will help facilitate some of that. Um, and we continually look for training opportunities to help provide those as resources out to providers. And we'll see a couple of those opportunities at the end of, I have some slides on a couple of resources for additional training. One of their other systems barriers is loss of insurance of young adults and costs of care. We probably all are familiar with this when our Wisconsin Medicaid system stops at age 19 and we go to Medicare services. There are significant differences in coverages, and it is really difficult for families to navigate and understand. For example, if incontinence care products were covered by this company under Medicaid for all of these years now, how do I obtain those under Medicare and how are they going to be covered? Therapy services is a big challenge for families, right? We might be engaged in PTOT and speech for years as a youth. And now suddenly the playing field changes when you are an adult. If they are no longer showing progress in a way that is deemed appropriate, they're just going to cap those services with Medicare. And so a lot of different navigational areas related to insurance. There are mechanisms for youth with special healthcare needs and disability to remain on private insurances after age 26 with families. Again, there's a lot of what I call red tape, a lot of hoops to jump through for families to make that happen, but it is possible. So I've always pulled this quote out from White and Cooley's article because I think it's just really striking and important. While our special populations may not represent the majority of youth transitioning to adulthood, in the aggregate, they include those most vulnerable to poor outcomes and higher healthcare costs. That's why we're doing the work that we do through the Transition Initiative. So what are those consequences? There are many. These are some of those that they highlight. Medical complications probably being the biggest one that many of us fear. Discontinuity of care, dissatisfaction on the patient side, higher ER utilization and hospitalization, health and well-being limitations, treatment and medication adherence issues. If you spend any time with Tim, he's going to talk to you also about how these just expand beyond everything. It's hard for us to do a good job at school and learn. It's hard for us to go to work and be a productive human being at work if we don't feel well and our healthcare conditions aren't managed. So the consequences move far beyond just the healthcare arena and our health. I think cost is huge. And I know there's a picture of money there. Yes, there's a huge financial cost that's associated with that discontinuity of care. There's also just a cost to independence, self-advocacy, lifetime productivity, achievement, employment, happiness, and well-being. So a lot of consequences if our youth don't transition to adult healthcare services for good continuity of care. So we'll talk just a little bit here about implementing, and then I'm going to go into our next module. So this is where there's some overlap with these two modules. So when I talk about implementing a youth health transition process, the place I always start is gottransition.org. GotTransition is our national partner. They are also maternal child health 5 grant funded, and it's a partnership between them and the National Alliance to Advance Adolescent Health. Um, and so they have done all of the work at a national level to really provide resources that are available to everyone. They don't charge for these resources. They are much like us, same license where please take it, disseminate it, use it, adapt it to work for your practice. And so they talk about these very 6 core elements in setting up a youth to adult healthcare transition program. Now, this could be utilized on an individual level by a provider. This can be utilized on a clinic level, regardless of the type, whether it's primary care or a specialty practice. This can be implemented on a systems level through a healthcare system. It can hopefully be implemented on a state level and then disseminated down, but that's really difficult to do. We've only seen that happen in a few states, basically through their federally qualified healthcare centers. So we have worked on it from the bottom up in Wisconsin. So when they talk about this, they talk about step number 1 being establishing a policy or a guideline on youth to adult healthcare transition. Step 2 or core element number 2 is tracking and monitoring of the work. Core element number 3 is assessing readiness. And again, this may be assessing the readiness of the individual with a disability. There are readiness assessments for providers or healthcare clinics or systems also. Step 4 is planning. Core element number 5 is the actual transfer of care and how you're achieving that. And core element number 6 is transition completion. Did you do it? Are you sure? And how are we assessing if you did it? And how did it go? To kind of look at that QI, that quality approach of, okay, what are we going to do different next time? I've offered here just a screenshot of a clinical practice guideline. This is the clinical practice guideline that was previously used at UW Health. There also is a clinical practice guideline at Children's Wisconsin. Interestingly enough, this one currently is unavailable in the UW system. I know they had approached me a couple of years ago about some potential adjustments and updating to it, and I think that they're probably in process on that. So they've pulled this clinical practice guideline from availability right now. Nonetheless, it is a nice example of it, and so I just have a couple of screenshots to highlight it. And if at some point you're interested in looking at those policies, Tim does have those available as PDFs for you to take a look at, even though they're not live in the UW system anymore. One of the things that I think is really helpful is thinking about that transition timeline. UW Health has integrated it nicely. GotTransition has this beautiful timeline, and this is pretty much mirrors it and really talks about what are we doing when with youth on this timeline. If you remember, we said this is a process. Start at one end and keep going. And so really thinking about those steps and which aspects of transition we're doing when. 12 is when they suggest, age 12 is when they suggest that we start introducing transition changes. If individual is going through the public school system, they'll have a transition individualized education plan at age 14. So it really mirrors nicely with that process in the healthcare system. Readiness assessments. As I mentioned, GotTransition actually offers a readiness assessment tool for all 3 aspects. So provider, practice, patient. And so if you go to GotTransition, type in readiness assessments, you're going to see those resources and you can go take a look at them. So one is an individual provider person saying, how am I doing? One is for the practice, saying how is our clinic or healthcare system doing at implementing transition? And then on the patient aspect, there are readiness assessments for patients to take. There are readiness assessments for caregivers, which is always an interesting. I always talk to people about maybe doing both when you see somebody the first time to assess, because it's always a little bit interesting to see where mom and dad or caregiver think we're at on this spectrum of transition versus our youth with a disability. And interestingly enough, there is some variability, as you can imagine, on those reportings. Um, there are additional readiness assessments that you can access through Got Transition that'll actually take you to some specialty readiness assessments that have been developed for specific healthcare conditions. So, for example, there is a readiness assessment with youth with cognitive for youth with cognitive disabilities. I think it still has significant limitations. Stay tuned. We're hoping to see more development on that in the next few years. There is also, like, there's a neurological one, there's a transplant one, there's a sickle cell one. So through Got Transition, you can access on through to those and see some of those specialty ones if they're of interest for a project or to kind of understand some of the adaptations that have been made. And so this is just a screenshot of the adult healthcare clinician readiness assessment. It's actually 3 or 4 pages, but this is kind of what they look like when you go and access them, and they can be downloaded in an electronic format or they can be printed and utilized that way. Um, this is an example screenshot. The one on the left is from Got Transition for their standard patient readiness assessment. The one on the right is actually a screenshot of one that they've been using for several years at Children's Wisconsin. I didn't go dig this month to look, but that's been available on their internet, sorry, for access for years. And so they've done some adaptations to it. At UW Health, they have done some implementation of some of these tools into the electronic health record. So that would be another thing to consider depending on a practice location for individuals, that some of these tools may be implemented in through that electronic health record. We're seeing more and more of that, but that is something a lot of people are like, oh yeah, they have Epic, so I'm sure it's there. It's actually on a very healthcare system level, what areas of it they have built out and where they have implemented it. So simply being on HealthLink or Epic doesn't mean that you will have transition tools available to you in that system. It varies. Um, in HealthLink and Epic, you can create smart phrases. And so this is something that we've seen a lot of our partners do, where they take some of this content and create their own user smart phrases. So as you think about nurse practitioner education and working within systems like Epic, this is ways that they can customize practice down the road. And UW HealthLink, they actually have a nice flow sheet, an education tab in HealthLink. Interestingly enough, though, this is only for utilization on the inpatient side and does not flow into any flow sheet or any note in any way, shape, or form that is helpful for future documentation. So again, great checklist. You can sort it by age, but all you can do is document if it was done. You can't extrapolate it anywhere else in the record. Some other ideas that I always talk about a little bit about different ways to kind of gain this assessment and this information when you implement, like our complex care clinic here in Madison at the Children's Hospital, they actually have put in the transition readiness assessment on an iPad. So when their youth and families come in and check in, they're handed the iPad and they go through and do their assessment that day. So then when the provider comes into the room, they've already got that score. They can talk about areas of challenge and next steps for progress. They also have produced their own cartoon video about youth to adult healthcare transition, a really cool example of a way to help introduce it to families and youth. So that is a live link if you have time later. If you were working within a course in which you had time to show it, it's just a few minutes long. I think it is 4 minutes, and really well done with voices and caricatures of individuals in their clinic. So when the kids watch it, they're like, "Ooh, that's Dr. So-and-so." So it's a lot of fun. So there are many specific tools that can be utilized. So for example, at UW, they actually have a transition toolkit. And so they try to keep all of these in one place. You'll see that in many healthcare systems. And that's a great way to try and streamline transition work within a healthcare system. So just a couple of resources when we talk. Again, Got Transition is a wonderful resource and a place to start. Additionally, at a state level, we have our work at the Youth Health Transition Initiative. And so that website there, we also have resources available, and we'll link you back to Got Transition, but have some additional state level resources, as well as some videos of yours truly if you're really bored on a rainy day and want to go watch a few videos. I mentioned earlier CME opportunity. I think this is really helpful when we talk about formal training for healthcare providers. This program here called Florida Hats has been around for years. I recently double checked this link. It is still active. It is 4 free hours of continuing medical education. It is a healthcare transition curricula. And while there are some, minute differences between state level information, at the broader level, it's still very good, very applicable training information. I talk about that national partner at the Center for Transition to Adult Healthcare for Youth with Disabilities. Great website. Go take a look at it, called movingtoadulthealthcare.org. Again, just some additional resources available when looking for materials for families and youth. Another CME opportunity. And I always have to, this is a complicated process from the online learning portal. You have to go through a couple of clicks and a couple of steps. But once you access it, there's actually a huge amount of continuing medical education that is free related to developmental disabilities. They have an entire section on autism. They have an entire section on transition care. And so following this link up here in the title will get you there. So if you're looking for additional opportunities for student learning. And then one opportunity I always highlight every year in October, Baylor College of Medicine out of Texas does a 3-day conference titled Annual Chronic Illness and Disability Conference, Transition from Pediatric to Adult-Based Care. It is held in Houston if you're looking for a very fun, warm event, but otherwise they always have a live stream version of it that can be accessed from anywhere in the country. So a great learning opportunity. References wise for this, we have the White and Cooley article, which is where the majority of this content comes from. And then just the resource for the Child and Adolescent Health Measurement Initiative, where some of that data came from for state level. And so that is module 1. Nobody interrupted me. So questions on any of that content or information from there?
I think it was pretty straightforward. I guess the one question I would have was, could I add any files to this folder? So for example, as I'm thinking about building out a module, this is going to go in our D&P population health course. I'm wondering, like, could I put White and Cooley in this folder? Could I put like maybe a PDF of the National Survey of Children's Health in this folder, just as a way to start kind of curating some of these resources? Or would you prefer I don't touch this folder?
I'll let Tim answer that question.
I do not have a problem with you populating this Google Drive. Feel free, because I can't imagine you're going to put anything in there that I'm going to object to or that I probably won't use. So please feel free.
Thanks.
So be aware that Tim might borrow it if he sees something good.
Absolutely.
That's okay. Fantastic. Great.
Exactly.
Julie, I did want to let you know, I think
Yeah.
you were on this meeting too, but meeting with Patience White with Got Transition, I think it was last week, said Epic now has a transition readiness assessment built in. It's a standard one, but still TBD, right? I don't think that changes the fact that not all systems will have it or have the same version. but it's less work to build a readiness assessment in because it's already there. My guess is you have to pay for it separately, but we don't know that yet. But they are.
Yeah, good to know. That'll be my lunch hour project on Monday. Then I'm going to go into my Epic Health link and do a little search and see if I can find one activated within our system. Good to know. I mean, you're absolutely right. That is like the first step. If they can have a universal, at least one readiness assessment universally available, so the implementation on a organizational level is easier. That's awesome. That's awesome. All right, I'm going to pop over to module 2 again. I think, and I know we have about 12 minutes left this morning, and I'm pretty sure we can swing through this because, as I mentioned, some of the content is duplicative in nature. So again, similar introductory slides. We just left these in place on all of these modules, not knowing for certain the time frame and how you wanted to utilize them. So I'm just going to skip through those here this morning, those introductory ones. The learner objectives from this module 2 is reviewing those 6 core elements of GOT transition that we just looked at, identifying the use of one tool to assess individual or practice implementation, and describe the use of one tool for assessing patient and caregiver satisfaction with the transition process on an individual provider or clinical practice. Again, that definition of healthcare transition that we're familiar with. And then starting back at our GOT transition national partner. And so they look at 2 goals for healthcare transition when we talk about GOT transitions work. And it's that improve the ability of the youth and young adult with and without special healthcare needs to manage their own healthcare and utilize healthcare services. And ensure that there's an organized process in that transition from pediatric to adult healthcare, looking at transition preparation, the transfer of care, and then that integration into adult-centered healthcare. So one of the things that I didn't mention that I talk a little bit more about in this module is customizing GOT transition resources. As I mentioned, all of the resources are available at no cost to be utilized and adapted as needed, as long as there is an attribution to their work. So you literally can go into GOT transition and you can do customizable PDFs. And so you go in, you simply put in a name and an email address, who you're with. That's all they ask for. And then you immediately get an email back accessing these customizable PDFs. And so you can change the colors on them for your healthcare system. You can add your logo onto them along with the GOT transition logo. You can adjust questions. So for example, if you look at it and say, these 22 questions are too many, I don't feel like we're going to dig into these in our clinic, but here's what's applicable to us. You can adjust the questions and adapt and use them for what serves best. So this is a really awesome resource. When we talk about resources to utilize with patients and families in clinics, it's not very often that someone is giving us a resource and says, hey, do with it what you need to make it work for you to do the work. So that's it's just a really cool feature that they have offered us. This transition implementation timeline is going to look familiar. Comes from that clinical practice guideline that I had referenced in module 1. And GOT Transition also has a beautiful timeline on their website. And they actually have a printable PDF version that you can utilize as a handout for patients and families. As we had looked at briefly previously, when we talk about the 6 core elements of healthcare transition, one of the things that they have done at GOT Transition is they have really focused these pathways and they've adjusted them a little bit depending on the situation in which an individual provider, practice, or system might be looking at. So if you look at that orange column on the left, that is for providers that are looking at transitioning youth to an adult healthcare clinician. So typically we would see this pathway utilized by pediatrics, family medicine, maybe our med peds clinicians. The blue column is transitioning to an adult approach to healthcare without changing clinicians. So this is more so our family medicine med peds. So for example, you are 14, 15, 16, 17. You are going to be moving into an adult care setting, but I am your family nurse practitioner and I'm going to continue to care for you, but you still need to transition some of your specialty care and learn how to be an adult in the healthcare system. And then that third column, the purple column, that's integrating young adults into adult healthcare. So this is kind of looking at the pathway from the standpoint of like where I come from in internal medicine. How am I going to receive these individuals into my practice? And what is the work that I'm going to do from my receiving end to help facilitate this process? So the way that Got Transition did this with the color coding, know that those colors code and carry throughout their resources. So if you're, hey, I have an internal medicine practice and I'm looking at this purple pathway, I then follow my purple pathway on those resources to see what's applicable and how to implement. And so, as I mentioned, there are 6 core elements. So on the left side of each of these columns, you'll see 1, 2, and 3. And so they talk very specifically about what does, for example, number 1, transition and care policy or guideline look like for that transition from adult to youth versus the purple. What are maybe those steps look a little bit different if you're coming from the adult aspect of care? And so this slide talks about the first 3 core elements, and this slide talks about the next, 4, 5, and 6. I don't spend a lot of time reading through these. This is a resource where you go there, you print it out, you look at it. It's pretty straightforward, but it really helps outline what are the steps in order that you're going to think about this implementation in your health system or your clinic system. And so I just pulled the orange ones here to see a little bit closer. And again, I'm not going to read these to you. They're very straightforward, but they really help outline that process. This is the blue pathway of those 6. And then I have outlined the purple pathway. Depending on where you're at with a curriculum program with students, you may delve into picking one of these pathways and really going through those 6 core elements and what those steps might look like. And so those are just another picture of those here. This is actually what it looks like on Got Transition, and you can go in and you could pick a guide for each of those core elements. You can pull up examples of what that might look like in a different clinic setting or practice for each one of those core elements. They very strongly encourage clinics and practices and healthcare systems to take a QI approach to the implementation of a transition process with patient populations. And this comes from that standard Riley definition of QI, right? Continuous and ongoing effort. So much so that they actually have available for you right on Got Transition what they call their QI primer. And so if you want to implement Got Transition and you want to use this QI process, here is the guidebook for you. We've made it easy. And through this guidebook, they even have, they have all the pathways, all the worksheets to do that QI process. I spend a couple of minutes just talking about how are you going to build your transition team? Because you can be the biggest cheerleader, right? I can be in my internal medicine clinic, you rah rah, we are going to transition every youth. But if nobody is supporting me and nobody else is doing it and no one else is on board, unfortunately, it has minimal success. So I talked just a little bit about making sure that we have secured senior leadership, that we've identified team members, that the team members within your practice or your clinic or your system stretch across all different disciplines, right? I need everybody from my person answering the phone, making appointments to understand the work, all the way down to my medical assistant who might be rooming with a little bit different workflow or providing a readiness assessment to fill out today, all the way down to my medical records department that I'm going to be asking, hey, can you scan in this readiness assessment since my health link doesn't have one available electronically yet? Okay. So really thinking about those workflows and that multidisciplinary approach across your clinic and healthcare systems, after you get that senior leadership buy-in. And really thinking about who are those key stakeholders. Have I included individuals with disabilities and their family and caregivers in this process? Because if I build this process in my clinic and I think this is a perfect process, but I have not gotten input from my patients and families that are going through this process, it will fail because I will not be able to foresee all of the challenges that come from that aspect of being the patient within our clinic. So really thinking about at least having more, at least one youth and family or more to make sure those opinions are represented and to be able to resurvey them after they've gone through that process. Making sure that you're doing adequate training within clinics and healthcare systems. This is a picture of that plan, do, study, act cycles for QI. Again, this comes directly from that workbook. Here is that worksheet to look at each step of that, outlining, okay, what are we going to do next? How did we implement it? What happened? And coming back to those plan, do, study, act cycles. They do have a payment tip sheet available. So know that that's there on Got Transition if you're thinking about how you're going to code this and charge for it within your clinic visits. And then readily available, as we had noted, how are we doing? Did this work? What's our next steps? And here is the readiness assessment, or I'm sorry, the transition assessment to say, how did that work go? And how did it feel for our providers? Did it work? Are they feeling like this is doing what we're supposed to be doing? And here is the surveys from Got Transition of how did it feel for the families and the youth? Is this doing what we want it to do? So this goes back to just a little bit of that data, as I previously mentioned in Module 1. About 28% of Wisconsin youth with healthcare needs special healthcare needs are getting transition services. That number was a little bit higher a few years ago. We had nearly hit 35%. And then this ugly gap right here is that thing that we're going to forever call the COVID pandemic. And so our numbers have dropped off a little bit, but still, a nice trajectory above our national comparison or our national average and above that goal of 23%. Big key takeaways, don't reinvent the wheel. If you know somebody else who's got a great transition clinic, go steal, beg, borrow, implement, ask them what worked, what didn't work. Remember that any transition work is good work. So even if I say, me as an individual implementing transition, maybe I can't effect big change on a big system level, I'm still effecting change for those individual patients and families that I care for. So any transition work is good work. And ask for help. That's what we do with the Youth Health Transition Initiative. We have other resources. So if you're looking for more resources, making sure that you're reaching out to Tim and we help figure out what you need. So that is Module 2, the implementation, as you see, that has some overlap from Module 1. And I think it varies on how this might be helpful in your curriculum. Right? This is pretty advanced clinical practice implementation, but I still think it's good information for DNP students that would go into a clinical practice.
I agree. And I'm just taking notes of ways that we could potentially fit this in and help to build their skill set so that when they do graduate, they have all of these tools to be able to implement this and even just be able to extrapolate to other quality improvement projects. Mm-hmm. My apologies, though. I do have another 10 o'clock that
yes,
I have to transition to. So I know we have other dates.
We do have a date.
Scheduled.
Next Friday is our next date.
Yeah.
And I was just going to ask, that is scheduled for 9 a.m. again. Is there any chance that a little bit earlier works that day? And if not, I'll keep it at the 9.
What time would you like?
I would do like 8 or 8:30 if it worked for everyone, but only if it works for all.
So let's ask. I mean, I can definitely go earlier. So 18th, 8 a.m. So I can send out an email to Michelle and Vicki and see if that works.
And let me know. And if not, we keep it at 9. I just got notice that my my kiddo going to summer camp, his pickup window is 10 to 12, and I have about an hour's drive. So I just
That's a
don't
bit
want him to be
tight.
the last kid picked up.
No,
So,
no.
but not a big deal. We'll keep the 9 if it doesn't work for all. Okay, great.
Super. Take care,
Thank you,
everybody.
Tina. See you
Thanks so
next
much
Friday.
for this morning. Bye-bye.
Yep.